This is Edgar Cadena from Tepe Oral Healthcare, and get ready for your unofficial dental hygiene podcast.
These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Hello, everybody. Welcome back to another episode of A Tale of Two Hygienists. This is episode 86.
86.
And I am with Michelle.
I am Michelle.
Poor Michelle. We are coming at you from under one roof, kind of. I'm still actually in Chicago. Michelle just made it back home. Mm-hmm. Halfway alive.
Oh, God. It kicked my butt. I don't know if it's my allergies or I'm getting a cold or what, but I'm feeling rough.
You're not getting old. That was a cold, right? That's what you said with a C.
Cold.
In front of it?
Yes.
Okay.
Even though maybe I am getting old too. I don't know.
Just maybe. I don't know. It was a really, really good conference. I'm going to throw that out right off the bat. Good job, Penwell. Good job, RDH Under One Roof. It was good. That for us, it was a really productive conference.
Yeah, but I still wanted to do so many other things that just didn't get done.
So, lesson that Michelle and I learned was let's not do 16 episodes or 17 or whatever we ended up with.
Michelle knew that lesson. Andrew did not.
No, Michelle knew the lesson of us not do. Didn't we only do like 10 last year? I think we only did like 10 last year. And then I decided I want to double that.
Yeah. And I was like, there's not a chance. So then we tamed it down to like 16. Oh, Lord. And that's me working the booth too. And all the parties and lecturing. And oh my gosh.
So what do you think would be better? Taking out some of those interviews or taking out some of the parties? Or, I mean, because there was something every single night. And then there wasn't like one single night. It was like one thing went to another thing, went to another thing. So like one night we did Trisha O'Hare's get together on top of what we had already done all day long, which I think that was Friday. Which was one of our big days for recording, and then the VIP for you at the booth.
Yeah. And then a VIP party, and then the young party. And
the young party.
Yeah, I went home before you because I had a lecture the next morning.
Yeah, and then Deborah Carrier had her fashion show.
See, I left before that happened.
Yeah, well, it was a late night. It was and the line to get in there was really long, and you had to take an elevator to get up to the foundation room or something like that.
Yeah.
But, wow, I mean, we saw all of our friends here, so that was really cool.
That was the best part. Probably the more exhausting part, honestly. Like a good exhausting. Like I love seeing all these people, but it's like you go to do one thing and you see 12 people on the way to the bathroom, and an hour later you're like, what just happened to the last hour of my life? But it's so good. And I still didn't see everyone
with all of her fans.
Oh, please. Oh, please.
I love her.
You're just as bad, dude.
To her and no, but shout out to our friend Lucy from Canada who came and saw us.
Yes,
really cool.
Lucy.
And guess what? And actually, this is probably going to be on this episode. We haven't actually made this episode yet. So we got a lot of people to record the intro to our podcast.
Yeah, that was fun.
For your unofficial dental hygiene podcast. So. Yeah, it's good. I think
I'm excited to see all those.
Something.
Or hear them. Really? That's crazy.
Yeah.
That's awesome. Good time, though. I love that idea. I don't need to hear my voice anymore.
I kind of got used to it.
I know.
Just kicking everything off. And so it'll be fun having, several months worth of other people's voice. But that also means, though, that if you're just a fan of the show or you just are one of our friends, send in your voicemail with a quick little... And I recorded everything on my phone because we did a lot of them on the exhibit show floor, exhibit hall floor, whatever that word is.
Yeah, whatever.
And just open up a voice memo on your phone. Say, hi, my name is so-and-so from so-and-so a place, and get ready for your unofficial dental hygiene pod. Do you know how many people had that right cadence that you do too?
Oh, really? That was awesome.
So funny. I'm like,
I wish I could have been there and like,
show.
Yeah, right. I wish I could have been like there on the floor with them while y'all did it.
Yeah.
I'm trained to the booth though. Good for you.
Don't worry. We had,
Glad you had
producer,
fun.
manager, assistant Mike to help us out.
Yep. You sold 0 t-shirts though.
Oh my gosh. And I got messages for that too later. They're like,
so glad someone else is giving you hell for it.
I didn't get a t-shirt. Oh my gosh. You know, though,
we can mail you t-shirts, folks.
Yeah, that was a big mistake on my end. Yeah, we can. I still feel like we got so much accomplished. Like, plus we were helping Matt with his project that he has coming up. So I don't know. I don't feel bad doing what we did. So good luck trying to make me feel bad, Michelle.
I just want to make you feel bad because I would like that money back.
I know. I should just buy your inventory from you, and then I'll make my kids sell them.
No, I'd rather make you feel bad instead.
Okay,
so
well, we can do that too. So
this episode is going to be a little bit different, and I think it's really, it's going to be a little different. So we're going to have an interview portion with Kim Miller. You probably have seen her name many times over. She's a speaker, consultant, and a columnist for RDH Magazine. And we're also going to put it on the back end or the front end is Booth Buzz.
Well, let's talk about it right now. That way our listeners get to understand what goes into making a podcast.
Yeah.
I don't know. What do you think? Should we do one on either side of it?
Ooh, I like that idea.
Or should we do... Okay. Maybe we'll do that.
So we were lucky. Yeah, we were lucky enough to do this a thing with Penwell, who is the publishers for like all of your major magazines, as far as RDH Mag, Dental Economics, Perio Implant Advisory, that whole line of publications. And we essentially went to 2 booths, Brasseler and Premier, and just really got a moment to chit chat with them and what their products are, and really kind of delve into some things that if you weren't able to take a moment on the floor, or maybe they were slammed and you did not get all your questions answered, or maybe you weren't there and you've always wanted to ask these things, or you didn't even know that they had some of these products and a new line of instruments and things like that out, you can get all of that with this episode with Booth Buzz. And
Brasseler actually has a really awesome promo code that you guys will hear at the end of the episode, because they're going to be on the second part of it. So make sure you guys listen to that part and use the promo code. Use it because it's awesome.
Yeah, really.
I'm not going to tell you what it is.
They give it out there. They give it to you for a reason, folks. Take the discount when you can.
That's a big discount. That's huge.
So anything else? It is. It was a really good one. I agree.
I don't have anything else. I think everyone should just be really excited about this episode. It was a wonderful opportunity for Michelle and I. We are very happy that we got those opportunities. So again, thank you, Penwell. Thank you for everyone that stopped by and was chit-chatting with us and hung out with us at the networking events and things like that. That was really cool. And even those that said, hi, brother. Hi, Mike, because everyone remembered him from previous episodes. And that. So thank you, everyone, for being supportive of him.
And thank you for like even coming up and saying hi to us, because it was like occasionally I would see somebody like say, like look over, and then eventually they're like, we just want to come say hi. Like, please don't be shy at all. We love to meet you guys. So, and thanks for supporting the podcast. If you have suggestions to help others learn about podcasting and the information, the content that these wonderful people who come to disseminate just great information, if we can find a way to get that out there for more and more people so that they keep hearing the message, please let us know. We appreciate everyone's support too.
Enjoyed the episode, everybody. Listeners, welcome to this special booth buzz. This is very exciting. We are at RDH Under One Roof.
Yep.
My name is Andrew.
Hi, Michelle.
And we have a special guest with us from Premier, Lil. Lil, welcome to the podcast.
Thank you. Thanks so much, Andrew, Michelle. It's so nice to be with you today and here in Chicago for Under One Roof.
With a bunch of hygienists, and you fit right in with us because you're a hygienist as well.
Yes, I am. I've been involved in dental hygiene for a very long time, more years than I'd like to admit. And
we're hearing that a lot this week.
And it is the appropriate name, Under One Roof. I mean, I can't imagine jamming any more people into one building that all do the same profession.
Right.
So it's pretty exciting. This is a neat experience for all of us.
This is one of our favorite conferences. This is fantastic. You can't talk to the hygienist any closer than when you're here all packed together. So it's fantastic.
It's always like a really fun atmosphere, and it's always a little uplifting and empowering too, which is nice. Yeah.
And the other exciting thing about this meeting is that you will continually meet people, whether it's their first time here or their 10th time, that they've met people here that have become longtime friends for them. Yeah. So they come together every year, and that makes it a little more fun for them.
Yeah,
absolutely.
So, but one of my favorite parts about this is, at some of the other conferences, and you're bumping around into dentists, endodontists, or whatever. Here it's going to be mostly hygienists, and you're a hygienist yourself, and you have a pretty cool backstory. What can you tell our listeners about where you come from and what you've done?
Okay, well, I've been, of course, a resident of the suburban Philadelphia area, Pennsylvania, all my life, and went through my education to become a dental hygienist and a clinical practitioner in a specialized office of periodontics. I worked in 22 years in clinical practice and then 8 more years in teaching dental hygiene students. So I saw it from both sides. And then one day I had this wonderful opportunity through networking to secure a position with Premier Dental, which I knew somewhat little about because it was a company that really specialized in dentistry. And I came in at the very right time because they were just starting to really build stories that I thought, encompassed products that help the hygienists and the way they practice. So that's been really the fun part of it is the people I work with, the president I work with, Julie Charlestein is just phenomenal. The whole family that owns the company, they care about what I think about our products, and I listen to the hygienists, and this is the perfect conference for that because I listen to what they want. I go back, I share that with our marketing and our product department, and I'm involved with some of the decisions that they make on our products.
So this is a family-owned company?
Oh, yes, it is. It's a 104-year-old company now.
Wow.
And when we celebrated our 100th year in the industry, it's one of the oldest dental manufacturers in the country, in the United States. We sell internationally, not just in the States and in North America, but it's 4 generations. And Julie is, of course, the first female operating this company, and she follows a real legacy of 3, spectacular men. And I think that the exciting thing in my position with the company being manager of professional education is that they see the value of education, not just sales. And that's important to me. Yeah.
I think it's important to all of us as hygienists.
I do too. Well, I would even say what's nice about coming to these shows, especially this one, you might have been using a product for a while and not even realized who it belonged to. Premier, I think, has quite a few of these. Like I just said, I was using enamel on, and when I walked up here, I was like, oh yeah, I use that.
Yeah, sometimes people don't identify a branding name to the company that it belongs to. And once we had begun our whole quest to build the products that have the technology of amorphous calcium phosphate, or what we call ACP, immediately we had to have a branding name that encompassed that group of products. So Enamel Pro is the name that people will hear, and most often they'll identify the Prophy paste because that went out like a line.
I remember when this came out, actually.
It is so exciting. So many folks come up to us and they're using it and they tell us how much they love it, the way it performs, the flavors, the patients love it. So it's a great product. And so that's selling very well. We have Enamel Pro Fluoride Varnish that, again, delivers a calcium phosphate technology. when someone doesn't understand that, they have to go back to a little chemistry review and understand how different different elements interact with each other. And so with these products, the whole delivery it's very soluble, bioavailable, and as soon as they start working in the mouth with these products, the calcium phosphate helps to improve the uptake of the fluoride. So it's not fluoride alone, but it's building the enamel at the same time. And you'll hear that with a lot of other products, but they just use different technologies.
Okay.
So we have to educate them, and that's where the education comes in. And then, of course, from those products, we then expanded into what we call our treatment gel, and that's Enamelon. And Enamelon gel, some folks had recognized the name because it was used in a different product years ago, but it was a very different product. This is a stannous fluoride. It has the ability to provide a moisturizing effect for people with dry mouth. And then there's the stannous being anti-caries, anti-gingivitis. The other great thing is that the flavoring in this is a very nice, fresh mint and mild. But boy, when you have people that we are seeing that are elderly patients that have risk for root caries or situations that encounter different, just uncomfortable things post-cancer therapy and just a lot of medications that cause dry mouth, they find that this is a really nice product for them to use. And they continue through the day. They find they can speak better. They can, they don't have to drink water all day to moisturize and feel comfortable. So it's been a great product. It's distributed through the practice. They can't walk in a store and buy it, but they get it through. And we believe that's important because the hygienist has to teach them what it is.
Hallelujah.
Hello.
Amen.
You walk in a store, right? And what do you see? Many, many products
and you don't know where to
all
start.
These different things, but I don't even know what they do. So I think that's another important thing. We now have gone into the dental sealant family, and now with all of this technology, we've even elevated to something even more exciting. Hygienists are well aware there are two different kinds of sealant materials they use, a resin or a glass ionomer. And folks that have used glass ionomer were really happy with the fact that it was fluoride releasing. But there was a lot of research that demonstrated some retention rates that were not very good.
Really easily.
Washing out, recurrent caries. We now have the only dental sealant on the market that is a 56% filled resin, which has the Smart Cap technology. That's a word you're not going to see as easily as the BioCoat, which is the name of the product for the sealant. But that's the technology and research behind these little microcapsules that are semi-permeable, and they release the ions of calcium phosphate and fluoride constantly. After you brush your teeth with fluoride, you're recharging it, and it's releasing it. So it's bioactive. And you're going to see a lot more dental products in the future that are going to have similar type, maybe not ours, maybe it will be ours, but it will have some of the same technology.
Interesting. Okay.
So,
I feel like, it's like a whole other side of the booth here.
Well, we have two pro angles, too. I think some of our hygiene friends are using the new Profi angles that are convertible, where you have a cup and you have a point. And the great thing is that if you have orthodontic patients, you use the cup first. You do what you can with that. You pop it off, which is real simple.
That's so
now
smart.
You have a nice little pointed tip that you can go interproximally around brackets and bands. So the 2 Pro has the 2 Pro Challenge, which you go online, and if you complete the information on there, it helps you, the hygienist, and the doctor in the practice to better understand if what you're buying currently is really the best, opportunity to save money, to utilize the Profi cups the right way. And then we send you some free material. We send you some free samples.
Very nice.
As that.
Can't beat that.
And the Tasty Tooth, not to mix it up with the Enamel Pro varnish, but our Tasty Tooth is a brand new varnish that is a 5% sodium fluoride varnish, but it does not have the ACP technology. And the reason that we did this is because we do know and understand that there are situations where a practice may look at cost only. And they say, you know what, I'm only interested in a straight fluoride varnish. I don't care about anything other than the fact that I want the patient to like the flavor and the cost. So the cost is good. The flavors are great. It's melon and caramel and bubble gum. And of course, our other varnish also has strawberry and cream. It has vanilla mint, and it does, and bubble gum. So it does have some great flavors, and so that's also our line extension with serving what people want.
Right.
We try to listen to what they want.
Listening.
That's right. So, and then we have been in the market of making dental instruments, and that's been long going. We make them and manufacture them in Philadelphia, so they're all USA, manufactured. And then we have our whitening line, which is a hydrogen peroxide. Works fast, 15-minute wear in a tray, water-based, safe on your teeth, and I think it's a great product. We find we keep that simple. People don't want anything with too much going on, but they like something that's going to work quickly. Compliance is improved because they don't have to wear it very long. And I love it because sometimes I'll put a tray in, get in the shower, and by the time I get out, it's done. And
do my makeup, dry my hair, and then I'm ready to go. And it's nice. 15 minutes.
You got it.
I totally understand that.
Right? I know it takes forever for him to get ready.
We're having a great
changing
time.
His shoes all the time.
We have our booth team. I select the booth team for the meeting every year, and I always like to kind of pull in the dental hygienists that are our sales representatives that are within a geographic area. But this year's nice. We had 2 product managers, Carol and Ann, who came to join us because they wanted to interact with the hygienists. Again, we believe it's important for us to go back now and say, hey, our product managers were directly face-to-face with them. Listen to what they want, explain to them, why we make something a certain way, and then I think they appreciate, hygienists appreciate that when you go that extra mile.
I know that they do.
I absolutely agree. Yes. Yeah.
And Chicago's fun.
No kidding. In the summer, it's fun.
It sure is. I know.
Midwinter, different story.
We know.
I thought that lake stayed frozen.
We know. So, but we've got a whole new branding. This is a whole changed logo now. We just launched this actually around midwinter time during the midwinter Chicago meeting. But I think because of a very new generation of executives in our company that are stepping forward with, we want to be innovative. And Inspired Solutions for Daily Dentistry is our branding now that goes along with our logo. But it just has a nice, clean, different look now from, our previous logo. And people are recognizing that we're dressing the color, too, to go with our red and grays and all.
Yes.
So it gives it a little fresher look. Yeah.
Nice. Well, thank you for telling us about all the amazing products from Premier.
Thank you for giving me the opportunity to share with you, and I know Premier does appreciate all that you do to keep information going on the podcast, so I'll be excited to hear some of the others as well. Thanks so much. Have so much fun.
Thank you.
Mm-hmm. You're welcome.
Hey, Michelle.
Yeah?
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine. Well, here we are again.
Well, hello there.
I don't even know. So,
Number 8.
We're still at RDH.
We are at RDH.
We are, and we're in person. What is this, 8th interview?
I think it's number 8.
Something. We're trucking it along, though.
It's been great.
It's been a really good day. So we are with Kim Miller.
Yes.
And you might know her from RDH Magazine and some other things. But
Yes.
I'm going to let you kind of formally introduce yourself and tell even maybe the new grad students, somebody that has their head in the sand that didn't know your name.
Okay, no worries. So, yes, I'm Kim Miller, and I do write a column for RDH Magazine called The Hot Hygienist, and I write about products and technology integration. So, if there's a new product, or even an old product that has maybe a new application or something that is tried and true, and we want to make sure that we're incorporating that into daily practice. So, sometimes I will write about products that have been around for a while, but maybe have just kind of fallen out of grace,
right?
For example. So, yep, I write that column. I am a national speaker. I probably should say international, since I have crossed the border and gone up to Canada. So that makes me international, right?
It
sounds super important when I say it that way.
I've only done it in Guatemala, and I still call it international. So
I think that probably even qualifies more than Canada, because we're kind of connected by land, right? You have to fly over an ocean to get to Guatemala, don't you?
You can go by land if you want to.
If you want to.
If you want to go through Mexico.
Why would you do that?
Through Mexico.
Right.
I would drive through Mexico.
How long of a drive would that be?
Gosh, forever.
How much?
You'd want to take a motor home, probably.
Have you ever thought about that, though? Sorry, I digress a little bit, but have you ever thought about driving from North America all the way down to the very tip of South America?
I actually have thought about that. I love to drive, and so I would be all about that.
I was thinking about that too, but think about gas stations. I know that there's gas stations out there because I've been down there, but it's like, I feel like it's not as numerous as it is in the United States.
So you're saying what happens if you run out of gas?
Yeah, really.
Well, I don't know. Don't you take dental floss with you? We can do almost anything with dental floss.
That's right.
I've done incredible things with dental floss. That's right. That's right. So let's see. In addition to writing the column, I am also an in-office coach. I'm a coach with Inspired Hygiene. And Inspired Hygiene has been around for a little over 10 years. I've been with them for, I'm going to say 6, right at 6 years. And with Inspired Hygiene, what we do is we have a group of coaches. We're all hygienists, and we go into offices and really help hygienists wrap their brain around this medical systemic connection, how that affects our patients, how we have moved and transitioned from being hygienists who scale teeth to remove calculus and maybe save teeth to being clinicians that are actually more about saving lives.
And teeth are just a benefit.
Well, right. I mean, look, my grandmother lived to be 104, and she had full dentures by the time she was 50.
Yeah.
I mean, you don't have to have your teeth to live a healthy, well life. I would prefer to keep mine.
Yeah.
I want mine because to speak and to eat and to articulate and to kiss. You can't really kiss very well with no teeth. I mean, just picture that, right?
I don't want to.
Okay. So Andrew's got that.
The picture right now.
Yeah, he's trying to kiss with your lips all caved in, you know. Yeah,
it's just like bone hitting.
Exactly. Okay, we got to move on off of that topic, right? So I also am I'm a 5-time graduate of the Baldonine Preceptorship course.
We talked about going to that.
Why are you talking about it? Just sign up
and do it.
Go. It not only will it change your life personally, it will change the lives of those people that you are in contact with, your loved ones, because what you learn at this course is just mind-blowing in terms of what we can do for heart attack and stroke prevention. And this last spring in the British Medical Journal was published an article by Bradley Bale and Amy Doneen that it's very, very scientific, but it's all about...
Dr. Bale was on the podcast and talked about it.
So so you know that what we really want to focus on is the landmark study, the layman's version of it. But there are 5 specific pathogens that create some incredible damage in our patient's cardiovascular system, and you know, if we're not managing those pathogens and we're not managing that biofilm infection, literally our patients run the risk of death. Right. And I don't think that probably when the 3 of us graduated, and I certainly graduated many years before the 2 of you. Maybe. I do it like this. I graduated in 19... like that.
Yep.
So you don't really know when I graduated, but trust me, it's been a long time ago. And when I graduated from dental hygiene school, it was all about the calculus. If you don't remove the calculus, you're a bad hygienist.
And like that,
I'm going to say, you mentioned something to new graduates. I will just tell you that if your focus is only about removing the calculus, you're a bad hygienist.
True.
That pendulum has completely shifted. It is really not about the calculus. Yes, we have to remove it. There's no hygienist worth their salt that's going to leave calculus behind on purpose. We do leave it behind. We can't get it all unless we've laid a flap. But really, it comes down to managing the biofilm. And managing the biofilm and helping our patients understand how to manage the biofilm is really what today's dental hygienist should be doing. And we are not just hygienists; we are healthcare providers.
Absolutely,
we can save lives through what we do with our patients, and we really need to step up and embrace that.
Amen.
As a group, as a profession.
Yeah, totally agree.
Absolutely.
We get in little pissing matches about calculus and the boards, and I hate the boards. And
when is that going to change?
Depends on who you ask. I hope never.
Because
because I like it. We hash this over with all of our guests, it seems like. But my biggest thing on it is until the schools can actually not get sued and not be scared about by not graduating people, because they graduate so many people. I've talked to so many directors and program deans who just they're scared. They're scared of being sued, and so they pass people and they say the boards are going to catch the people that don't deserve to do it.
Why would they be sued? I don't get that.
I don't know either, but it happens.
A university would be sued?
Universities and community colleges get sued
for what? Providing
because if they don't pass the student.
The student's like, I paid my tuition, I did the things you told me to do, and you're not passing me now.
Yeah, and so they're getting sued, and that's the problem. So if that wasn't happening, I could be a little bit more,
Well, you could knock me over with a feather. I've never heard of that. If I didn't learn what I was supposed to learn when I went to school, it wasn't the school's fault. It was my fault, right?
That's the way it really is.
I mean, it should be that way,
It's a very litigious society. That's not the way it is anymore.
Wow.
So.
I
think you get some maybe little entitled people, parents that are like, that's not acceptable. And
I don't want to say trust fund babies. But
but kind of with that same mentality.
Yeah, I get that. I don't know any trust fund babies, so I don't really know.
They're not in my circle.
We don't have
falls in that category.
If any of you are, though, listening and want to be my friend and pay for me for a bunch of stuff, that would be great.
Sponsor the podcast.
Okay, but if they pay for you with that and then something goes wrong, will you sue them?
Yeah, because they're so rich.
Oh, just checking.
Obviously. Buy me a boat, and then when the boat doesn't work after 20 years, and then I'm going to sue you for giving me
I'll smoke cigarettes for 25 years, and then I'm going to sue the manufacturer because I didn't read the label that said I could get lung cancer.
Right?
Exactly.
Okay.
This is our society.
So as long as we're on the same page, as long as we understand
That's right. I get it.
But I do get frustrated with the boards because of that. Like, because we're not looking at health-based outcomes. We're looking at just your...
Can you mechanically remove this hardened piece of stuff from the tooth?
Right.
That all of our worth and our value is based on my ability to scale teeth. And that day is over. We got to move past that.
Because I've had some amazing students with that can talk about, like, deliver a treatment plan and really put it in such... They talk to the patient like knee to knee, face to face, and we never taught them that. Like, that was just something that came supernatural
they knew
to them.
Do that. Yeah.
And I'm like, you know what? They might not be strong scalers, but they're going to be amazing, like, treatment coordinators or even everything.
Let's talk about that. They might not be strong scalers. In other words, you mean they might leave calculus behind?
Yeah.
Okay, so I worked for a periodontist for 10 years, and he was a wonderful man, and he delighted in having the hygienist who did the pre-surgical scaling and root planing for the patient come in when the flap was laid, right?
I've had that happen to me.
Do you see the calculus left behind?
Makes me shudder. Well, I don't want to see that.
But hear the whole story, because while, yes, I agree, and there was always calculus, right? I mean, we know
we're in a 7-8 millimeter pocket,
but we know after 5 millimeters, we're going to leave calculus. And I don't care if you won the Golden Scaler Award or not.
Right.
You're going to leave calculus. If you're not laying a flap, you're going to leave calculus behind. Well, here was the fascinating thing, was that the doctor would lay the flap to do the osseous surgery. There would be calculus there, but the tissue was healthy. Okay, so think about that for just a minute. There was no inflammation. There was no active disease. The disease in the tissue was in remission in spite of the fact that there was calculus there. How could that occur? Because the biofilm was gone. So we have to get this straight in our heads. Calculus does not cause periodontal disease.
No.
There are only two components of periodontal disease: biofilm, the living organism, and the host response. Calculus is an artifact. Okay, so I don't want to be misquoted. Do we want to get it off?
Yes.
Yes. Do we leave it behind on purpose?
No.
No, but we're always going to miss it.
True.
I feel like I want to stand up in the room and say, hello, my name is Kim Miller, and I leave calculus behind. Let's just get that straight.
I've done this.
Right. I don't do it on purpose.
But
guess what? Take a deep breath. Calculus doesn't cause periodontal disease. It's all about the bacterial organisms invading the tissue and then the host response to that. Calculus is a component, and we should remove it. But we already know we're not going to get it all, so we got to kind of get over that hump, and we need to think about what is it that we're really doing for the patient. And helping the patient manage their biofilm, that's what we need to wrap our heads around.
Yep, what they can do at home. Well, my thing with my students has always been like, well, what you do in that chair, how long that's going to last them? It's going to last them, what, a week? If that? If you didn't teach them anything? Like, so your procedure, you just stressed yourself out to do the best, and you spent zero time with that patient to teach them how to maintain this.
Yes, but, Michelle, even if we teach them, right, wrap the floss.
Yeah, it's
stroke down the side of the tooth,
not
into the
in
bottom
that
of
manner.
the pocket.
Yeah.
Even if we're teaching them some type of biofilm control like that at home, they still can't get their implements and their devices much deeper than 3, maybe 4 millimeters on a really good day.
Right.
So they need our support. They need they need us to be helping them on a regular basis with biofilm management. There's an article that was in JADA, the Journal of the American Dental Association, back in the 90s, and it very clearly said that a patient that's in perio maintenance should have their teeth cleaned. They should have a perio maintenance procedure somewhere between every 60 and 90 days, 2 to 3 months. And that was written a long time ago. And, if we would follow those guidelines, we would have patients that would be a lot healthier. Yeah.
Well, and I think when we go back to the biofilm removal, that it's not just like scaling. I mean, there's so much to it. And we talk about the glycine air polishing side of it.
Yes. So, interesting that you mentioned that, because I just taught a course this morning, hands-on piezo, and we did a little segment on subgingival air polishing with glycine powder. So I think, first of all, what our listeners need to know is that you would never do subgingival air polishing with sodium bicarb. No. You would rip up the tissue and you would damage the root surface. But glycine is an amino acid and has a hardness on the Mohs hardness scale of round about 2. Well, dentin on the Mohs hardness scale is right about 2.5. So the amino acid glycine is perfectly safe, not only for the root surface, but also for the epithelial lining of the pocket. Because when we use subgingival air polishing, not only are we spraying the side of the root, but also the wall of the tissue.
Right.
So
where
the sulcus wall,
and
the sulcus wall is getting treated as well when we're using that subgingival air polishing with glycine powder. And we know that there are those gram-negative pathogens that will actually burrow in to the gingival caul, and that non-keratinized tissue is so susceptible. So we want to wipe out the bacteria that are laying up against that non-keratinized tissue, and we can do that with subgingival air polishing.
And this is where Dr. Hyland, in a previous study or a previous podcast, was talking about how floss actually only cleans the side of the tooth. It does nothing for
the tissue. Right.
And that's why a lot of our perio patients, when we're screaming floss, floss, floss,
it doesn't matter if they whistle Dixie and stand on their head while they floss.
It's not going to make a difference.
They're not going to be able to reach where the problem is.
Yes.
So I'll tell you, I have an interesting story about my daughter who's in her early 30s, and she went to see her hygienist a couple of years ago. This is when this whole event happened, and she had 4 millimeter pockets and bleeding. Well, she's a daughter of a hygienist. She knows she's not supposed to have bleeding gums. She knows 4 millimeter pockets are no bueno. So she calls me up. She's crying, "Mom, I have gum disease. What am I going to do?" And Samantha, the hygienist, said, "I can't do anything for you. You should just go buy a water pick and start using a water pick." Now, please don't misunderstand. I love water pick. I'm not saying a water pick is not a good idea. But for a hygienist to say to the patient, "There's nothing I can do for you," oh my gosh, right? Because why? Because there was no subgingival calculus. There was nothing to scale off the root surface. The best way we can do biofilm disruption, well, there's 2 ways that our preference would be ultrasonic instrumentation and subgingival air polishing. With ultrasonic instrumentation, there was some research that came out of Germany probably 2 decades ago. And what they did was they took pathogens and they exposed them to sonic and ultrasonic vibrations for 10 seconds, 20 seconds, 30, 40, 50, 60. And they determined how long do we have to expose the pathogens to that level of vibration or that frequency before the cell wall is lysed and the bacteria is broken. And it's 30 to 60 seconds. Depending upon the bacteria. So the deeper the pocket, right? Usually the badder the bug. And I know that language is bad, but I'm saying that on purpose.
I like
right?
that, though.
The deeper the pocket, the badder the bug. I need to stay in that pocket longer. After calculus removal, I should spend a full 30 to 60 seconds in each infected pocket just treating the biofilm infection. And that's not what we learned in school. And even recent graduates didn't learn that. They learn scrape, scale with a curette.
Yeah.
When the root is smooth, move on. No. Once the calculus has been removed, that's just the first step. Now you have to go back and you have to blow the smithereens out of the biofilm. Think about icing a cake with icing. Right? What are we doing? We're smearing the icing around. When I take a curette and put it in a pocket and move my curette in the pocket, all I'm doing is smearing the biofilm around. It's gooey, it's sticky, it wants to be there. It does not want to leave that warm, dark, cozy space. So stop trying to scale biofilm. Remove the calculus and then go back in with your ultrasonic instrument with your slimmest tip or insert that you have. Turn your stroke width on your unit all the way down and spend 30 to 60 seconds and blow the smithereens out of the biofilm. The biofilm is what's going to hurt our patients medically, systemically. Those are bad bugs. They're very dangerous bugs.
That's why I'm always so surprised when hygienists are like, my doctor doesn't want me to use the Cavitron. He thinks that's like the lazy way out.
Oh, can I just tell you that the Cavitron, well, you're talking about magnetostrictive.
Yeah, so
let's keep
ultrasonics
in general
like,
come in two categories. Magnetostrictive and piezo.
And they just don't want you to use any. They want hand scaling.
No, but hand scaling is smearing around the bugs. Using an ultrasonic is blowing the smithereens out of them, breaking the cell while you're actually terminating the pathogens. Right? I want to have a T-shirt that says, I'm a Terminator. Right? I terminate biofilm.
Yeah, there you go. That's a good one. You'd probably sell a lot of those. So, but that's why I'm like, the research has shown for quite some time this is a better way to do it, but there's still such an antiquated approach to patient management.
And better doesn't mean easier. Better doesn't mean easier for the clinician. It's not faster for the clinician. I mean, you time it. I challenge all the hygienists that are listening. Hold your ultrasonic insert in that pocket for 30 to 60 seconds. You're going to want to you can plan your dinner menu in your head while you're doing that. You just have to put the instrument in the pocket and let it do its job. I mean, if it's magneto, it's 30,000 cycles per second. If it's piezo, it's 40 to 60 per second. I can't move my hand that fast. I get 1 stroke per second with a curette. So you give me an ultrasonic, I'm going to be able to do way more therapeutic service for my patient than with a hand scaler.
Do you have a preference, piezo versus magnetostrictive?
You know what? I don't. I tell hygienists all the time, what do you like? You show me what you like, and I can show you how to make it do what we need it to do in the pocket to remove the biofilm.
I like that. I like that a lot.
Now, I think that there is a lot of confusion about insert selection and tip selection. I think that hygienists oftentimes will just get the thinnest tip or the thinnest insert that they can, and they think that they're, that's going to get them into the
universal of them all kind of thing.
Yeah, but you really have to set your intention. What am I doing with this insert? And am I trying to remove subgingival calculus? Then you need to make sure you have an insert that's designed to do that, or a tip on your piezo that's designed to do that, because they're not all designed to do that. And if you use a biofilm disruption tip or insert on a piece of calculus, you will burnish it. And now you have to deal with burnished calculus, which is much harder to get off than if I had just left it in its...
and certain settings are meant for those tips.
That's right. That's right.
You might ruin your tip and all these things.
Or break it, fracture it. Absolutely, if you use it at the wrong setting.
Which is a bad day for everyone.
So here's what's fascinating is that there are not a lot of hands-on courses for ultrasonic instrumentation available to hygienists.
I know.
Okay, but are you ready for this? I teach them. Are you listening, people? I teach them all over the country. I will come into your office and I will teach you how to use your ultrasonic instrumentation in the best possible way to benefit your patient.
Which is excellent, because it is really sad how little, or people are like, well, I don't have a problem with how I'm using it. Like, I'm good. Like,
maybe they don't know.
Yeah,
they don't
exactly.
Know.
They don't know.
Right.
And so they just assume, like, oh, I'm fine. Mine works. But you don't know what you don't know.
That's right.
Getting educated. That's just, everyone needs more education.
And still, in dental hygiene schools, not all, but in some dental hygiene schools, the hygienists only use the Cavitron, or ultrasonic scaler. They only use the ultrasonic scaler on 1-2 patients, and they have to kind of qualify right? They have to have a certain amount of deposit or a certain amount of stain or be a certain level of difficulty. We're missing the concept that ultrasonics should be used on every single patient. In fact, the protocol that I teach and that we at Inspired Hygiene teach is that first, when you've got a prophy patient in the chair, whip out your heavy ultrasonic insert or tip and remove all of the supragingival calculus. Then polish and floss if you want. You can floss later, but you can floss then if you want. Polish and then put on a slim tip or insert, and now you do your biofilm disruption. Now, just a point of clarity. In a prophy, you can't spend 30 to 60 seconds per pocket. You don't have time. That's when I'm providing therapy.
Can I ask a question about that?
Yes.
So, would you still need to do that type of therapy on a prophy
patient
appointment anyways, though?
Biofilm disruption? Absolutely. Even if their gums are not bleeding, they have biofilm. We know they have biofilm there. So my job in a prophy really is to prevent the patient from having periodontal disease. And if I don't go around the mouth in every pocket and begin to disrupt that biofilm for that patient, I'm not doing my job for that patient. Because my job is about prevention in the prophy. Prevention. And so I want to be in those pockets when they're not bleeding with my ultrasonic. And I know that you have some listeners that are thinking, no, I want a hand scale. Okay, 1 stroke per second. Ice that, right? Just smear that biofilm around the root surface like you're icing a cake. Or put a slim line or a slim tip in the pocket and flush out the biofilm. It's like the difference between washing your car with a rag or using a power washer.
Is there a benefit to, let's say that you only have 40 minutes for a prophy or something like that?
If you only have 40 minutes for prophy, find a new job. Sorry, go ahead.
But is there still a benefit to doing maybe 15 seconds or 20 seconds?
Sure.
Is there benefit to, even if you don't have the 30 to 60 seconds?
Yes, absolutely. In fact, when we're doing a prophy, I'm really pretty much in and out of that pocket. But I still am going to get way more disruption and movement of that biofilm than if I went in with a curette.
Yeah.
So if... it's lysing the cell wall within 30 to 60 seconds. Is it continuous seconds, or
yes?
So it has to be within that moment.
And it's not one tooth; it's a pocket.
Oh, yeah.
So I'm in during therapy, after calculus removal. I'm in an infected pocket for 30 to 60 seconds.
Okay.
And the deeper the pocket, the longer that I want to stay. I want to err on the side of 60 seconds rather than 30 seconds. And you'll notice when you're doing this clinically, at first, if the tissue is bleeding, which would be why you would be in the pocket that long, if the gum tissue is bleeding, you're going to see kind of a dark red, thick bleeding first, and then the longer you stay in the pocket, it starts to become more watery and pink. That kind of gives you a signal that you've pretty much disrupted the biofilm, you've debrided that area. Again, I'm going to say after the calculus is removed, then you go back in with your slims and you attack the biofilm. So removing the calculus is just the first step.
Of course, yeah.
But I want to finish a thought I started that I didn't get finished because Andrew asked me a question.
I know, I'm sorry.
No. The question was great. So I was talking about in a prophy, remove the supragingival calculus first and then polish and then do subgingival biofilm disruption throughout the mouth. Now, if I have a patient in the chair whose gums are bleeding at all, even in one area during that prophy, and I polish last, where does the pumice go?
It's down into the sulcus.
It's down in the sulcus. And you know how we know that the pumice stays down in the sulcus, even if you rinse well and you floss? Because hours later, after your prophy, hours later, you go, okay, crunch, and I'm crunching on grit in my mouth. Where did that come from? It came from my sulcus.
Yep.
How did it get in my mouth? Crevicular fluid flow.
Pushed it up.
Right?
Yeah.
So the crevicular fluid pushed out the pumice, but that was hours later. I am disserving my patient if I polish them last and I let them walk out the door with gritty, sandy pumice in their bleeding pocket. Now, how is that helping my patient to heal?
So this has
Even in
actually
a
been
prophy.
an interesting topic I've noticed on Facebook in the probably last 3 months is, when do you polish, before or after? And
Kim says polish in the middle. Remove the supra.
Yeah.
Quoting you.
right?
Remove the supra, polish, and then do your subgingival biofilm disruption. And why doesn't that model work with perio maintenance? It does.
It does. I
Remove
used to
the
do it in
supra.
every perio patient I ever
If the
saw.
patient has no supra, then you start with polishing. Polish and then do your subgingival biofilm disruption. And in perio maintenance, it is appropriate for me to treat up to 3 areas that have active infection in perio maintenance. The ADA wrote the code that way. I think the trap we fall into with perio maintenance is that as hygienists we think we are like heroes, and the patient has generalized recurrent active infection in a perio maintenance, and I try to treat it all.
Yeah.
And so now what I'm doing is, instead of a bloody prophy, I'm doing a bloody perio maintenance. And then we just get the patient on a cycle of bloody perio maintenance. And that's not helping my patient. That's dangerous for my patient.
Absolutely.
Those bacteria are getting in their bloodstream and wreaking havoc.
It's just a little bleeding, though.
Well, okay, so Amy Doneen says a bleeding pocket, even 1, is a problem. But get this, if the patient has AA in their mouth, AA, when it enters the cardiovascular system, gives us off that endotoxin. It's a leukotoxin, actually. And when that leukotoxin is swimming through my bloodstream, it prevents the endothelial lining from repairing. Okay, I have 60,000 miles of blood vessels. And if AA is traveling through my bloodstream, it's damaging the walls of all 60,000 miles of my blood vessels. And that leukotoxin that just keeps trickling in like a drippy faucet prevents repair. My cardiovascular system wants to repair, but it can't because nobody's shut off the biofilm drippy valve.
Yeah.
It just, every time my gums bleed, the biofilm drips into my bloodstream. It gets on a crazy cycle. So I have to tell you that my most favorite product that I'm all about right now is Perio Protect trays. And I'll tell you why. Both my daughter, her husband, and my husband have all used Perio Protect trays. My husband has the widowmaker condition. That means on the left side of his heart, the descending artery is narrowed. So we did, about a year ago, we did a periopathogen test. He had AA over the threshold. And I'm like, this is not okay. You have to get this under control. So we had 4 quads of scaling and root planing with laser. We tested, we did a clinical laboratory test with oral DNA labs after. His AA went up, not down.
Really?
Well, AA happens to be one of the pathogens that Jürgen Slotz identified as being resistant to scaling and root planing, even with laser. And such was the case with my husband. So and we waited until his first perio maintenance to redo the test. AA went up. So he stayed in perio maintenance, and he's really faithful and really diligent with his home care. We tested again. Still, these bad bugs, he could not conquer them. Our dentist suggested Perio Protect trays, so he did those, and within 3 months, all of the pathogens are down. Every single one of them down under the threshold, and guess what? His gums don't bleed. And he's really happy because now I'm kissing him again.
It's always that's the upside of it, right?
Why that's scary. While he had scary AA and PG and TD and TF in his mouth, we were like, nah.
Transmissible bacteria.
That's
we don't
right.
need that in our lives.
That's
Not
right.
at all.
And, since you mentioned the fact that they are transmittable, I wonder if our listeners know that they did a study a few years ago in Japan where they checked dogs' mouths.
Yes, yeah.
And their owners, and guess
We
what they
talked
found?
about that on with Dr. Bale and Dr. Larkin.
All right. So everybody's heard that. Yeah.
Yes.
What's the moral of the story?
Don't kiss your
swap
dogs.
spit with your dog. Come on.
Or make sure that their perio is under control,
their
too.
mouths are not cleaner. I don't know where that...
Perio Protect for dogs.
Hey, how about that? Right. Actually, Evora has a pet powder that will actually help to reduce the pet's bacteria.
That's
you just
awesome.
sprinkle it right on their food.
Nice.
Evora.
Oh,
it's a probiotic. Oral probiotic for doggies.
I put my dog and cat on Plaque Surge.
Okay.
Which is the seaweed something or another.
Well, seaweed has lots of antioxidants in it, so that's good.
So apparently, wherever this was created was originally for humans, but it had the seaweed taste, and nobody wanted to eat it.
People didn't like it?
And so they had some research showing that it demineralized calculus in a way.
Okay.
And so it didn't stick to the tooth. So you could literally take your finger and like pluck it off, and no one wanted to eat it though. So they formulated it for animals. But it's still, I mean, I could eat the same thing that I give my animals.
Well, seaweed.
Plaque off is what it's called.
Seaweed is really good for you.
And it's whatever kind of seaweed that this is, like Chromia genuine.
It might be the kind of seaweed we don't like.
It doesn't smell great. It smells like fish. So, and my cat loves it, but... Yeah.
So your dog and your cat are plaque-free?
They're plaque-free.
Which also means their breath is pretty good.
And I do occasionally scale their teeth. Well, the dog's teeth at least, but she kind of hates
like
it.
A true hygienist.
Right? Kept my scalers from hygiene school. It's perfect. So we don't want to keep you too long. I know you got a crazy schedule today.
Well, I have a course to be at. I don't want to miss the mega session. Yeah,
absolutely. So for some maybe words of wisdom for new students, new grads, or even veteran hygienists that are kind of in it.
I've got those words of wisdom. Okay, I'm just going to recap a couple of things that we already talked about. Number one, get yourself to the Baldonine preceptorship course. Yes, it's an investment. It's probably the most expensive CE course that you will ever purchase for yourself, but you will never be sorry. It's an amazing community of healthcare professionals. And one of the things I love best about it is that the physicians and the nurse practitioners are embracing the hygienists and the dentists and appreciating, I think, what we do and our role that we play in healthcare. The next thing I would say is master ultrasonic instrumentation. If you don't know how to use it, if you're unsure how to use it, if you're not using it on every patient, you haven't mastered it. There's no reason to pick up a scaler, even on children. Children have biofilm.
Yeah.
Why would you use a curette? A curette is, if you think about it, I'm sticking a double-bladed instrument in between a very small space on a child's mouth. Why would I do that when I have this tiny little ultrasonic instrument that I can blow the smithereens out of the biofilm with and get the calculus off in such a painless
isn't there
way?
Like people feel like you can't use ultrasonics on a certain age because it's going to damage the enamel and whatever.
Okay, so are there precautions? Yes, we have to be careful around demineralized areas. We have to be careful around all porcelain crown margins. The only time you have to be worried in a deciduous tooth is a newly erupted deciduous tooth where the pulp chamber is large. But that doesn't mean don't use it. It means just don't sit on the tooth and let it run.
Crank it up to whatever the highest setting is.
Right. Biofilm is very easily destroyed with our ultrasonic instrumentation. And you don't have to put a lot of lateral pressure against the tooth for that. So master ultrasonics, take the Baldonine course, and find a mentor, find a coach, find a mentor. I'd like to give my email address.
Please.
It's kim@inspiredhygiene.com. Find a mentor. Find someone that can help you understand case presentation and what it is to help a patient understand their disease. We're so much beyond removing calculus to save teeth. We are lifesavers.
Totally agree.
That's what our mission is.
No, that's great. Yep. You're one of many that have said that, so it's nice to have that just reiterated.
Is there an echo in this room?
Yeah. It's really nice.
It's a needed echo, though, for sure.
Yeah, absolutely.
Yes.
A needed echo. 100%. Well, thanks for taking the time. Glad it worked out. And you could come and chat with us for a little bit, and definitely contact you and look up. Where's your speaker schedule?
Oh,
do you have one?
My speaker schedule? My speaker schedule appears on Inspired Hygiene's weekly e-zine.
Okay.
But if anyone wants to know where I'm speaking, they can email me.
Perfect.
I'm happy to tell people where I'm speaking.
Awesome.
So coming up this year, let's see what's next. CDA, California Dental Association, San Francisco, the scientific session. I'm doing 4 programs there, 2 hands-on courses and then 2 lectures. And then the ADA, I'm doing 2 hands-on workshops at the ADA. And then I think that's that for this year. I think that rounds out my speaking schedule for this year.
It's starting to slow down for conferences, though, once we get October.
Well, then what we have in November, the Greater New York.
And then it just dies for December.
Right.
Yeah.
Right. And then in January, February, we get to start all over again.
Over again.
Yeah.
It's the cycle. Well, thank you again.
You're welcome.
Yes.
My pleasure. My pleasure. This was fun.
Good. Hi, welcome to Booth Buzz. I'm Michelle from A Tale of Two Hygienists.
I'm Andrew from A Tale of Two Hygienists.
And we're at the Brasseler booth with Brenda Sharp McCarson. Nice to see you.
Good to see you.
How are you?
I'm great. Great meeting, having fun, talking to all my friends.
It's not bad to be at RDH in Chicago.
No, not bad at all.
Fantastic. And we're here to talk about some of your instruments with Brasseler.
But before we get into that, maybe Brenda, you can tell us a little bit about yourself and a little bit about your journey through dental hygiene.
Okay, sure. I've been a dental hygienist for almost 40 years. I started out in clinical practice. I got an associate's and then got my bachelor's in Charleston, South Carolina. I had some early back injury issues and opted to go into sales. I had a great opportunity and with Brasseler, and what attracted me to Brasseler is that they are one of the only companies that will sell directly to the dental hygienist.
Wow.
And thank you for that.
I actually did not know that.
I tried to purchase hand instruments as a temp hygienist and found that no one wanted to sell to me. So the Brasseler rep came in and asked me, do you need anything? And I thought, well, I need a fingernail file. I said, well, any instruments? I said, well, no, Brasseler won't sell to me. And he said, oh, yes, we will. So when I had the opportunity to work for Brasseler, it was a no-brainer, and I've been there for 14 years.
Oh, wow. I did not realize.
And I work primarily with dental hygienists. My goal was to grow that market, and we've done a really nice job of introducing innovative products for the dental hygienist.
What's one of your newest innovative products?
The latest and greatest is the new Implant Pro. We have a series of scalers, curettes, and the probe. The probe was the first instrument we introduced in this line. Although it's very applicable for probing around implants, we introduced this to replace plastic probes. If you'll feel of that, you're both hygienists, if you feel of the markings, you'll notice it's completely smooth.
Yeah, I don't feel like delineations at all.
No.
The probe is titanium. It's it's pure titanium, medical grade, not heat treated. The 6AL 4V, similar to that of the implant. We did coat the probe for the contrast so that you're able to see the markings.
Yeah, because it's gold compared to your titanium.
Correct.
Yes.
Correct. We're not concerned with probing that there will be any residual
spicules left or anything
because we're probing.
Right.
Whereas with the other instruments we introduced, the scalers and curettes, those are also the medical grade titanium, and they are not coated, and primarily because we really do believe that when you're doing debridement, there is the chance of anything that's a coating, that there may be some residual particles.
Absolutely.
Right.
So we opted. I know that some companies like to make them prettier. They're very soft. This is the 25 to 31 is the Rockwell hardness. So if you can even take your thumb and see how they flex. They're very flexible.
Oh yeah.
The series that we used to offer, it was Implant Pro. We had them for 10 years. They were very effective, very popular. Lasted, we know hygienists have had them 10 years because you don't sharpen these. The finishing
okay, that was my next question.
You don't sharpen.
Okay.
But one of the complaints that we were receiving from hygienists is, man, they're a little bit too thick. Can you make them thinner?
Yeah.
So that's what we've done. We took our popular LTS Gracie series, which is a line of Gracies that we offer that are 20% thinner than the we don't sell the after fives, but we have what we call mini longs. So we're 20% thinner, elongated terminal shanks. So
yeah, they are very long shanks.
That's what we are introducing. We have a Gracie 1-2, a Gracie 11-12, 13-14, and then your traditional 4R4L.
I was gonna say,
and also for the hygienists who can't live without a sickle scaler, we did a mini 204S. So,
I'm one of those hygienists.
I am as well.
Yeah.
The handles are PEEK, out of a PEEK plastic. PEEK.
Okay.
So those, it's a military grade plastic, so they're not going to break down throughout the mini sterilization cycle.
They're very strong, very strong plastic. That's awesome. And there's quite a few of them here. And so with your other products, are there ways for people to get lunch and learns and things like that?
Yes, absolutely. You can, we have approximately 100 sales reps, district managers across the country and Canada, and they certainly can come in and do a lunch and learn. If you have an opportunity where an office has 12, 20, 30 hygienists or even a study club, then I'm more than happy to do that, and you can contact me.
Perfect.
And we can schedule a lunch and learn.
Wonderful. And do you have another question?
Well, I heard that there's a promo code that we're going to be running for this particular podcast series.
Yes, and it's very simple. Podcast. So you can, it's pretty cool.
Right?
It's great.
Simple and easy.
That was a beautiful idea. Whoever thought of that?
Someone has a really smart person.
That's right.
So just if you can, through your Brasseler sales representative, or just call in to our customer service line, and you tell them that you heard the podcast and that you're going to get 25% off if you use podcast.
Nice.
That is a great deal. Thank you so much for doing that.
Yeah.
That's good.
And I just want to make note that outside of hand instruments, you have quite a few other items because there's a whole hygiene line, correct?
Yes. We not only do we have any hygiene instrument that you could imagine. We can always make one that's not been made yet. But it takes about 12 months for that. We do have a popular cordless hygiene, cordless handpiece.
Yes.
That's a hot item these days.
The cords are going to kill us.
Yeah, they are going to kill us. They killed me. That's why I'm in sales. But we have had our handpiece for about 12 years. And we were the first, and a lot of hygienists do not know that we have it because we do deal directly. Our marketing is much stronger than it used to be, but we do have that cordless. And the great thing about our cordless is that it accepts any profi angle.
Nice.
And when it no longer charges, you can just open up the back and add 2 new rechargeable batteries. So
it's very nice.
Okay.
Yes.
Nice. How long does it stay charged?
A full day.
Oh,
You're doing a full day.
Yeah.
But, one thing I do like to make sure dental hygienists know is these devices, they're wonderful, they're cordless, but they are power driven.
Okay.
Therefore, you're not going to be removing Paradex stain.
Sure.
Oh, yeah.
Okay.
And heavy tobacco stain. They're great for
Well, that's good information, though.
Yeah, that is.
I appreciate that.
Yeah. And so cordless, and then you also have piezo.
We have piezo ultrasonics. We have air polish. We have an air polisher. We have a very popular hygiene air handpiece as well. It's called the Hygiene Pro Air.
This guy here?
This guy right there. Very popular.
I think my students have this.
Yep. That's a lot of schools use this because we say it's student-proof. You can drop it, and it doesn't break.
Lord knows they need that.
A lot of those are around, and we do especially with the new recommendations from the CDC
that we need to be changing our handpieces.
And as you know, in South Carolina, where it's required.
Yes.
You must. The shall, it says shall always, but in South Carolina it's must. And I think 11 states it says must sterilize between patients.
Awesome.
So where can they find this line?
You can go to the Brasseler website. We are up and running, a great website where hygienists can set up their own accounts. We encourage, even if you're not going to purchase, we encourage you to set up your own account. So anytime there's something new, whether it's a webinar or a discount for hygienists, you'll immediately get that information from Brasseler. So, we encourage you there, through your office. We are direct, so your sales rep, and through me at meetings. I'm at all the major shows. I love for hygienists to come and meet and talk and hang out.
Great.
It's a fun place to hang out at the Brasseler booth.
Oh, you have some diamond instruments over here, too. Starting to see new instruments every time I look over.
Yeah, well, we were also another first for Brasseler. the diamond finishing files. We were the first to.
Oh, I did not know that.
Yes, see, you learned something.
I did.
The original design, as many hygienists my age know, was a single-ended diamond-coated instrument.
Yes.
And they came directly from Germany. And with ergonomics being so important, they were a little heavy, they were thin, so we brought those into the U.S., and now they're double-ended, but they're equally high quality, and it's a big seller for Brasseler.
Nice.
Well, thank you so much for taking the time to do this with us. We really appreciate it.
Yeah, it's great to visit.
Yeah,
all right.
I had a great time.
We'll do it again.
Yes.
Soon.
Awesome. Thank you.
Oh, Lordy.
Yeah, well, that's not a good way to start.
RDH, you kicked my butt.
Is there a pretty good lag in our conversation here?
No, I think mentally I have a lag.
Okay, well, okay.
Mm-hmm.
You ready to start? I'll start.
Yep.
It's fine.
Okay.
I got it. You sound terrible. Sorry. I got this. Hold on. Let me just stop laughing at you for a minute.